Good afternoon, everyone. My name is Max Ostermeier. I'm the CEO and founder of Implandata. We are a commercial stage company based in Germany, and we are going to transform the management of glaucoma patients by introducing remote disease monitoring and management. So the major challenge in treating glaucoma patients today is that there is only very limited information about the intraocular pressure and the therapy effectiveness in between office visits. And that's because usually you only gather a few data points during the year. In between office visits, there is no understanding at all how effective a therapy really is for the patient. Another challenge is that in many cases, these random IOP measurements or snapshots are biased. A huge problem is there is no reliable method for patients to perform disease self-monitoring. And that's also the reason why still a lot of patients show poor compliance to taking their eye drops. So these are all factors why patients suffer progression, despite the fact there is a lot of treatment options to control the disease. So in order to solve this problem, we have implemented the iMed system, which allows remote monitoring and management of glaucoma patients. It consists of a tiny implantable microsensor, which continuously measures intraocular pressure under real-life conditions. That data is then provided to the eye doctor remotely, and eye doctors can set an alert so that they know immediately if a patient's disease gets out of control. Another important factor is that we are empowering patients. Patients now can perform self-monitoring easily at home. That might not suit for all patients, but many patients are really demanding for that. So both more effective therapies applied by the eye doctors in a more timely fashion, as well improved therapy adherence, will result in slowing down and stopping disease progression and avoiding costly disease progression. Here you can see this tiny implant. It's really a mixed microsensor, which can be implanted in many situations. So right now we are doing it in conjunction either with cataract or glaucoma surgery, but in the next step it can be also combined with a mixed procedure. And ultimately, it will be also used in a standalone in-office injection procedure. The more interesting part than the device is, of course, the data, the information we are providing. And here you can see two patient examples being followed up for 1 year. And all these data points are real measurements taken by the patient. So really, instead of only having a few data points, maybe 3 to 4 data points during the year, you have now hundreds to thousands data points. And that information really enables the eye doctor to apply more effective therapies immediately, because now they have the full picture. Instead of guessing around, they really understand what's going on with the patient and how they respond to the medication. So the next steps for us now are to do a soft launch in Europe, to go ahead with our ID study under the Breakthrough Device Designation, and also to work on the data integration, because I think the data is really the key. So I think we are addressing an important need because there are still so many patients progressing. So we are enabling precision medicine therapies and patient empowerment. We have a clear lead, we have very strong IP, we have CE mark, we have obtained FDA Breakthrough Device Designation, data is extensively published. And the nice thing is that we also have a very attractive business model because we can generate recurring revenues based on established CPT codes for remote patient monitoring. And as pointed out, we have a very sound and long validated technology which has been tested in humans for years and years, and demonstrating that the device is safe, that it's performing very well, providing reliable information, and that it's efficacious. Thank you.